Hello everyone, my name is Manav Mandal
And my name is Atharva Gurav.
and our topic is diabetes prediction.
So we are going to look at the factors that are responsible for diabetes in adults, and later we are going to apply some machine learning models to identify, to create a model which can give us the perfect results for early detection of diabetes.
Here we look at factors in a person's lifestyle that are responsible for his or her chances of getting diabetes.
So this is the main agenda of our presentation. First, we will look into what diabetes is and how globally it has affected everyone. Also, we'll have some overview of the data set, and later on we'll look at the progress that we have made so far. So diabetes is a chronic medical condition and that occurs when body cannot properly regulate blood sugar. So insulin is the hormone that regulates sugar levels in the body. So the pancreas either doesn't produce enough insulin or the body cells don't respond properly to the insulin produced. So there are typically two types of diabetes, that is type 1 and type 2. Most of the times type 2 diabetes is mostly common into adults, but type 1 diabetes can be more fatal as it attacks and destroys insulin producing beta cells in the pancreas. So overall, at the global level, more than 536 million adults are are currently affected by diabetes, and the number is said to be increasing till the year 2045. So, so we'll look at the data set that we have taken. So it is the CDC data set. Uh, it is a data set that contains healthcare statistics and lifestyle survey information about people and about the diagnosis of diabetes. So it has overall 35 features, and it contains features about the demographics and the lab results, as well as there was some survey undertaken for the patients, and the answers to that are later on quantified and added into the data set. So the target variable is whether the patient is obviously whether the patient is healthy or pre-diabetic or diabetic. So this multivariate data is later on converted to binary classification, as in the pre-diabetic and diabetic patients are considered as one, and the healthy patients are considered as another category. So overall, there are 21 features that are very important in this dataset, which was the dataset was previously cleaned, and the missing values were handled already. Also, the age category was further bucketed into 13 level categories of 5 years each, like 40 to 44 years and 45 to 49 years. Then the purpose of the dataset is obviously to help people create models for diabetes predictions, and so on. So we'll look into the EDA part, that is the exploratory data analysis, from now on. So as we can see, this is the first category that we made according to the features that we look into. So the demographic analysis is done on the four features, like the age distribution, gender distribution, education level distribution, and income distribution. So if we look into the first feature, that is age, we can see that from the age level of 8 to 10 or 11, we can find the majority of the population of the conducted patients. So this includes patient from like 50 years to 64 years. So this is the major chunk of the people that are diabetic. So it's pretty normal age consideration if we look into. Then later on, if we move into the gender distribution, then it's pretty balanced, like there are equal number of male and female participants in the survey. Later on, if you look into the education level aspect, that is the 4, 5, 6 categories have the highest number of patients. So the 4, 5, 6 are the ones that have attended a higher level of schooling. So we can assume that these patients have a job profile which doesn't involve much of physical work. So maybe that also affects the further diagnosis of diabetes, which we'll look into after the feature importance part. Also, the income level suggests the same thing, that the people with the highest income have the highest chance of getting diabetes. Next. So the healthcare analysis is done, and through this also we can see that most of the patients have a medical insurance, and have also gone to the doctor if necessary. Like, the second pie chart here shows that if a person needs to go to the doctor but can't afford due to lack of money, so we can see that only 9.4% of the people couldn't go to the doctor or get a medical attention due to lack of money. So overall, we can say that the data is pretty much is not affected by any medical conditions due to external factors like money.
Thank you, Atharva. Now I'd like to take over and let's look at the cardiovascular health analysis. We plot three bar graphs where we look at high blood pressure distribution, followed by cholesterol distribution and cholesterol check distribution. We find a pretty much an even distribution in both the high blood pressure as well as high cholesterol distribution, where both the parameters, that is having a high blood pressure and having cholesterol, seem to be balanced, with a few thousand imbalance present. But when we take a look at the cholesterol check distribution, it stands for have they recently gotten a medical checkup done for their cholesterol within the last 30 days or within the past 2 months. We find very few people have not gotten their cholesterol check, but a lot of the candidates present in our dataset in our survey regularly get the cholesterol check done. Lastly, we take a look at the stroke distribution. We find out 6.2% of the total population have been affected by strokes and heart conditions, and the majority of the population has not yet been affected by stroke. And this includes variables from healthy patients, pre-diabetic, as well as diabetic patients. This is followed by a distribution of BMI with categories. It is not a normal distribution, nor is it symmetric. We see a right tail, all, and the data is said to be right skewed. We find the normal and overweight portion of the data set to be centered around the mean of this distribution, whereas the overweight and obesity seem to be imbalanced. We find a lot of obesity patients present when we compare them to the underweight patients, and hence the right tail. Let's take a look at the exploratory data analysis. We use correlation matrix to understand the features and how they are correlated with each other. The highest correlation is present in general health. This parameter indicates have they gotten a medical checkup done, general health checkup done, or it depends on have they got any injuries in the past month or the past 2 months. We find that it is highly correlated with our target variable. Around 40% correlation is present. This is followed by parameters such as high BP, BMI, high cholesterol, age, and different walks, difficulty in walking. The least important feature, according to the correlation matrix, is cholesterol check and heavy alcohol consumption, which follow the figures of 11% and 9%, approximately 9%. We used various models, and we initially divided the data set into three parts, where 60% of the data set was used for training, followed by a 20% split in validation and 20% split in testing. We tried SVM, logistic regression, random forest, KNN, decision tree, and finally naive Bayes. The validation results are as follows. SVM gave the highest accuracy, which was 86.13%, which is closely followed by logistic regression. Naive Bayes did not give as good accuracy, but it is still notable, which was 77.13%. This was a accuracy score metric from sklearn. We also used the confusion matrix, and the results are as shown in the figure. Now, our plan is to use support vector machine or support vector classifier on the testing accuracy, see how well it performs, and then try it with ensemble learning methods to boost the accuracy of our overall model. The progress so far is as follows. We've done the exploratory data analysis, found out a relationship between our attributes and our target variable. We used various graphs to take a look at how the demographic is, how the how the survey is distributed. We used various models, as mentioned in the previous slide, and the testing accuracy is still left, but validation accuracy looks promising. Finally, we plan to use feature importance using SHAP. So, what is SHAP? SHAP stands for Shapely Additive Explanations, and it is a pretty popular approach where each feature is given a value called the Shapely value, which it indicates the contribution of that value to the model's prediction. Higher value indicates the model is greatly affected by that particular attribute, whereas negative value or a lower value indicates otherwise. Now, feature importance is pretty important because we can't really depend on the correlation matrix. It just gives importance of how individual features are related with a target variable, but with feature importance using SHAP, we plan to see how the factors that we considered important are really affected by our model and what weight have they been assigned to. Thank you.